All right. I think in the interests of everybody's evening, we'll get started. My name is Patty Stark. I am the Community Mobilization Coordinator at the Injury Prevention Center, and I'd like to take this opportunity to welcome you to our webinar tonight, Concussion, Promising Prevention Strategies. And I'm just going to give you a bit of information about the technical piece of the webinar, and then I'll hand it over to our co-host. Just for your information, your microphone will be muted and your camera's disabled for the entire presentation. If you need a transcript, you can click the CC label live transcript in the bottom right-hand corner of your screen under More. This webinar is being recorded and it will be posted at a later date. We will send an email out when it is available. If you have any connection or technical difficulties, please use the chat function and you can chat with our guru behind the scenes to help you out. It will be open before and after the presentation, but the chat function will not be available during our presentation this evening. And there will be a Q&A period after the presentation. You'll have to use the Q&A box to submit your questions. And again, that Q&A feature is at the bottom of your screen. We'll answer as many questions as we can in the time we have left. And so without further ado, I would like to turn it over to our co-host, Lindsay Terhorst, who is the Executive Director of the Sport Medicine Council of Alberta. Lindsay.
Thank you. Before we start the webinar, on behalf of the Alberta Concussion Alliance and the Injury Prevention Center, we recognize and honor that the traditional territories of the First Nations, Métis, and Inuit span across the province. We deeply appreciate the diverse Indigenous histories, languages, ceremonies, and cultures that have shaped these lands for countless generations. We acknowledge the land as an act of reconciliation and express our gratitude to the Indigenous people, both past and present, for their enduring stewardship and connection to those territories we reside on or are visiting. Thank you. Next slide, please. Tonight's webinar has been made possible by members of the Alberta Concussion Alliance. The Alberta Concussion Alliance is a group of professionals in Alberta who have come together to provide strategic direction in our community about concussions. The Alberta Concussion Alliance has been working diligently to make events like this one possible as we lead up to an important day. This Wednesday, September 27th, marks the third annual Alberta Concussion Awareness Day, which falls within National Concussion Awareness Week. For many people, this day will come and go like any other, but for those who have had a concussion or know someone who has had a concussion, they may wonder why every day isn't a Concussion Awareness Day. The Alberta Concussion Awareness Day was established to increase concussion awareness by providing credible, evidence-based information and resources to encourage action across Alberta. This day is for all Albertans, regardless of their level of involvement in sports, recreation, and physical activities. As we lead up to this day, we encourage you to go check out the Alberta Concussion Awareness webpage. We can provide this link in the chat for you. This webpage has been tailored to make it as easy as possible for all Albertans to access information about concussions, concussion resources, concussion education opportunities, as well as a campaign toolkit. This toolkit details how you can help spread the message about Alberta Concussion Awareness Day, as well as how you can encourage others to do the same. Now I will hand things over to Kathy Belton from the Injury Prevention Center, who is also the co-chair of the Alberta Concussion Alliance.
Thanks, Lindsay. And it's now my distinct pleasure to introduce Mr. Ash Kostad. Having suffered a life-altering concussion in his youth, Ash has devoted his life to better understand concussion with an emphasis on prevention. I still remember the first time I met Ash at a sport injury prevention center event, and you told your story, Ash, about your concussion, and it really hit a nerve for me and everyone that was in the audience. So I'm really glad that you're here with us. Ash is currently a PhD candidate within the Sport Injury Prevention Research Center at the University of Calgary, and his research examines concussion prevention through policy and personal protective equipment in youth collision-based sports. Ash is a co-author for 2 of the risk reduction strategy papers that were used to inform the 5th and 6th International Consensus Statement on Concussion in Sport. And Ash will share the current evidence and possible insights for concussion prevention across multiple youth concussion-based sports. Welcome, Ash.
Thank you very much, Kathy, and to everyone for having me here. Very excited to kick off Concussion Awareness Week and be asked to present on something that means a lot to me. So I'll go ahead and share my screen. All right, that should be the right slides. Hopefully you can
Yep,
see.
we're good, Ash.
Excellent. So I have the great pleasure of talking about concussion prevention today. I'm, as Kathy said, I'm a PhD candidate at the University of Calgary. I'm supervised by Dr. Carolyn Emery and Dr. Brent Hagel, and they've been extraordinary mentors to me and really fueled the passion for me to engage in concussion prevention research. I don't have any direct conflicts to disclose. I work part of the Shrike Concussion Study, which is funded by the National Football League Scientific Advisory Board, but that's not a conflict of mine. I also coach para ice hockey here in Calgary, and I'm someone with lived concussion experience. So why I wanted to get into concussion prevention research was, like most of us, I started out playing lots of sports, being super active. Lacrosse and ice hockey were my main sports. And then when I was 12, I suffered 2 concussions within 2 weeks period from each other. This was 2009. And they were from ice hockey and being body checked, right? And about 14 years later, in a couple of weeks, it'll be 14 years, I've had symptoms every day since. And it's really fueled a passion and really a motivation to pursue prevention work so that no one has to go through what I have. But now I'm safe to say that I'm here. I get to present to all of you, and I've had a great experience with getting involved in research. And I thank you all for being here because we all know that concussions suck. And this was an art project that I did while going through my concussion recovery to try to keep busy at the worst of it. And I thank you all for being here. So for today, the overview will just be about some concussion information, some methods that we use to look at concussion prevention, the prevention strategies themselves, which are split into policy-based, personal protective equipment, training strategies, and then an overall summary and conclusion. So first, this is a bit of the first part of the most recent, the 6th Concussion Consensus Statement definition for concussion, and this was released a few months ago. So sport-related concussion is a traumatic brain injury caused by a direct blow to the head or somewhere on the body, resulting in an impulsive force transmitted to the brain. And I think the GIF below really does an adequate job of showing what a concussion is. It's the brain sloshing around with inside the skull. If you weren't aware, about 70% of concussions in Canada are suffered by youth. 1 in 5 Canadian youth have had a concussion in their life. Each year, it's about 1 in 10 youth. And concussions are actually a huge financial burden on our economic system. And if we break this down by sports, the worst sports for concussion are rugby, which has the highest concussion rate, American football or tackle football, how I'll refer to it, ice hockey, wrestling, and lacrosse. And when we think about prevention, there's really 3 areas of prevention that exist. There's primary prevention or risk reduction. This is what I'll be talking about today. And this targets everyone before concussion occurs, right? Trying to prevent the concussion from happening. There's secondary prevention, which is early detection, early diagnosis. So after concussion occurs, right, it's trying to prevent any extraneous results from that by getting it checked out right away. And then there's tertiary prevention, which is comes after the detection diagnosis, and these are for management and care related things. And as the age-old saying goes, prevention is better than cure. So if we can prevent it from happening in the first place, that would be the most ideal. And when we talk about primary prevention, this is an injury prevention model that we use. So this is called the Van Mechelen model sequence to injury prevention framework. And it's a 4-step process that repeats and continues on. So the first step is understanding what the burden is. What's the burden of concussion within an activity or a sport? The second step is determining risk factors, or what's causing these injuries to happen. What's the mechanism for it? 3 is trying to intervene on what's causing these concussions if it's intervenable on. And this would be implementing some type of a prevention strategy, which I'll discuss today. And then step 4 is evaluating the prevention strategy, and the loop continues on and on and on. And I'll say that for a lot of sports, we're just starting out. So with para ice hockey, ringette, and box lacrosse, we're sort of in the stage of step 1 to step 2, where we have a little bit of information about concussion, but not a crazy amount. Whereas other sports, ice hockey, rugby, tackle football, they're much further along. We understand the burden, prevention measures have been implemented, and they just have been looped around. And this is quite an important model to think about, because it really can inform us of sort of the no-brainer prevention strategies. So I'll just speak now about the main concussion mechanism in collision sports. For tackle football and rugby, it is the tackle. It's being tackled and being the tackler. And for ice hockey and other ice-related sports, it is the body check. So body checking is high-intensity physical contact. And right from seeing statistics like these, it would make most sense to intervene with prevention strategies for the tackle and for body checking. Now, to evaluate research around looking at the tackle or body checking, there's really 3 main domains that are used, and currently they're a little bit disjointed. So the first one is video analysis, where we watch the game or practice, see what's happening. The second is injury surveillance, which is the most useful because there's an injury occurrence, or the most impactful because there is documented concussions, injuries, what have you. And then the third one, which is a bit of a newer domain, is accelerometry. So hooking up a sensors, they now make them in mouth guards that we're trying to implement with players to measure the magnitude of impacts. And each of these has their pros and cons. For example, video analysis, we're seeing what happens in games, but it's sort of hard sometimes to look at magnitude. For injury surveillance, right, this is an injury event, right? It's an extreme case where someone was injured and maybe wasn't able to play. But not every contact that happens in a game or practice will lead to an injury. So we might be missing a bit of the picture there. And accelerometry on its own is great for giving us a number, right? A magnitude of an impact. But it's quite limited in us not really being able to see what's happening in game, if this was even an impact or if it was a false reading on the sensor. This is how it is currently, but in the future, we're really looking for prevention research to have this holistic combination of approaches where we have video analysis of the game, we have injury surveillance, and we have accelerometry. So if that someone gets a concussion, we can look back at it on the video and then also measure the corresponding magnitude. Now, for the rest of the talk, I'm going to talk a little bit about some of these avenues. I'm not going to talk about the accelerometry. It'll be more about video analysis and injury surveillance, but these are the three main domains for concussion prevention. So we have policy and rule changes, and I'll talk about body checking policy, head contact rules. We have equipment use or personal protective equipment. I'm going to talk about mouth guard use, helmet fit, and headgear. And then we have training strategies, where I'll talk a little bit about neuromuscular training, contact training across different sports. So we're starting off with body checking in youth ice hockey. I just want to first clarify the difference between a body contact and a body check. So a body contact are the lower intensity contacts. These are permitted during play. And I'll just show you a quick video. And if you could just watch these two players and they contact. We'll play it again. Oh. Right, the player receiving the contact is not totally affected. Right, the point is across where the player initiating the contact edges them out. Right, that is part of a lot of leagues of hockey. Body checking is the one that is the main risk factor for concussion and the main mechanism. And these are sort of the contacts that would make you go, ooh, when watching play. They're high intensity, heavy force. There's an extension of the trunk of the player initiating the contact, and the player receiving it is almost entirely affected. And the work into body checking and concussion and injury as a whole really started with my supervisor, Dr. Carolyn Emery, who looked at what is causing injuries in youth ice hockey. And what she found that body checking was the leading mechanism. And her subsequent studies in there compared leagues that allowed body checking, which were Alberta, to leagues that didn't allow body checking, which was Quebec. So Quebec has not allowed body checking at the youngest ages of under 13, or formerly known as Pee-wee, since 1986. And this allowed for comparison between leagues body checking and non-body checking. Right, and what she found was that if you allow body checking, you have a 3-fold greater risk of injury, 4-fold greater risk of concussion, right? A significant impact. And what this research really led to was Hockey Canada banning body checking at this Pee-wee or under 13 age group, which is 11 and 12-year-olds. It sparked controversy across the country, as I'm sure we are all aware. And this also ignited sort of a change at the older age groups, where individual organizations, here's an example, Hockey Edmonton, Hockey Calgary had one, where they disallowed body checking at the older age groups in the non-elite divisions. So to evaluate the policy, to see what's going on before and after body checking was prohibited, there's two main methods that have been used, the first being injury surveillance and the second being video analysis. Whenever I talk about injury surveillance, essentially players are signing up to be part of the study. They're followed throughout the season. We gain baseline information on them. We follow them for their participation in games and practices, and also any injuries that are sustained throughout the season. And then we look at the number of concussions or number of injuries and compare injury rates. So an injury rate would be the number of injuries over the season divided by how long the player played. The second method is video analysis. So this is where we, like I said, we capture in-game footage and then analyze it for different metrics. And the metrics that we look at are body contacts, as I showed before, versus body checking, head contacts directly inflicted by an opponent versus indirectly with the environment after collision or hit with the opponent, and other contacts not made with the trunk of the body. So these could be stick, like slashes, limb, like punches or pushes, and so on. So when looking at the most controversial age group, I would say, is the under 13. I'm going to show now the injury surveillance on the left and then the video analysis results on the right. red triangles are body checking allowed, and the blue squares are when it was prohibited. So from an injury surveillance standpoint, right, a policy of not allowing body checking reduced the rates of concussion by 64% and reduced the rates of all injury by 50%. Right, significant reductions here. The results from our video analysis, because injury surveillance may not paint a picture of what's actually happening in the game, is after this policy was introduced, there was an 82% lower rate of body checking and 39% lower rate of total trunk contacts made between players. There was, interestingly, a 10% increase in stick and limb contacts, but overall, there are significant reductions in both concussions and in-game body checks, which shows that the policy was effective and enforced well. And just for context, this would save just under 5,000 concussions each year across Canada, just this one policy at this one age group, and 6,300 injuries. Now, at the next age level, the non-elite divisions for the under 15, so these would be 13 and 14-year-olds. Injury surveillance shows 40% lower concussion rates, 56% lower injury rates. And our video analysis showed across the board lower rates of body checking, those high intensity contacts, head contacts, and all types of contacts. So once again, significant reductions just after a simple policy change, with over 6,300 injuries prevented just at this age group in the non-elite levels across Canada. And in the under 18 age group, once again, the non-elite division, so these would be ages 15 to 17. Injury surveillance, significantly lower concussion rates, 51%, injury rates, 62%. And with video analysis, once again, across the board, significantly lower rates of these high intensity body checks, head contacts, and any other type of contact. And once again, this would be significant in preventing over 7,000 injuries just at this age level in these non-elite divisions across Canada per year. But a common question that rises with this research is, what about unintended consequences? So if you delay body checking versus have body checking experience, how might this affect what's happening? Dr. Paul Eliason, who's a colleague of mine, looked at this for his doctoral work, and what he found was that at the under 15 age group, when compared with having 0 years of experience, the concussion rates were similar to 1 year of experience. But interestingly, the 2+ years of experience was lower for a concussion rate. But when he looked at this at the under 18 age group, it was the opposite effect, where if you had more previous body checking experience, you were actually at an increased risk of concussion compared to having less experience. So overall, with the context of the prevention of concussion at the individual age groups, there is no overall unintended injury consequences for delaying body checking in games. And just to summarize it all, this was from the most recent concussion consensus statement, which was from Amsterdam. This was the paper that Dr. Eliason led, that I was a co-author on, looking at prevention strategies for concussion. This is a meta-analysis, meaning it combines all the papers in an area and sort of documents them to get an overall effect at the bottom here. But as you can see with the individual studies here, they're all on the side of this dotted line that would indicate lower risk of concussion when body checking is prohibited. And as an overall summary here from this finding here of the overall, right, 58% lower concussion rate when body checking is prohibited. Right, the policy appears to be effective through our video analysis work, and a combination across all the leagues, that would be just under 20,000 injuries prevented each year. But an issue is that this was mainly in male or boys youth ice hockey with little work in female ice hockey and other ice sports. So just preliminary results here that we're working on here is this is when body checking is not allowed. So body checking is prohibited in boys ice hockey, girls ice hockey, and ringette. And this is the work of a colleague of mine, Emily Hemming. And what we're finding is that through video analysis, there's actually significantly higher rates of body checking contacts in a game for girls ice hockey and ringette compared with boys ice hockey, despite both of these sports not allowing checking. So future research really needs to look at female sports and understand what's happening in the game. The next area of policy that has the most research for it, I would say, is head contact policy. So Hockey Canada in 2011 implemented a head contact rule. This is Rule 6.5 that penalizes any player head contact. Our lab examined this previously before and after the rule change. So before the rule change was the year 2008, 2009, and then after the rule change was 2011, 2012. And what was interesting is that after the rule change, there was significant increases in concussion by almost twofold. And this led us to wonder why. Why, after a rule designed to eliminate head contacts, would there be an increase in concussion? Well, we think it's likely because of the timing and the groups used to compare, because after the rule change was 2011, 2012, which was, if we all remember, after the shocking news of Sidney Crosby having his concussion and being out for the remainder of the season. So perhaps this would lead to increased media, increased awareness, and reporting of concussion. But nevertheless, we wanted to examine this further using video analysis to see what's actually happening during the game. And what we did was we compared head contacts within a game before policy and after. And these were head contacts that were penalized, I should say. So what we found was that before the policy, 13% of head contacts were penalized versus after the policy, 16%. So not much of a change there. And what's interesting as we delve into other video analysis and other sports is that it's even worse for female ice hockey, ringette, and para ice hockey, where despite all of these sports having such head contact policies in place, the enforcement of this policy is quite poor. And that leads us to question, why is it so poor? Right? Is it because referees are maybe feeling unwell to enforce it due to maybe pressures from coaches, players, and fans? So a lot of work needs to be done here, because I think this policy could be quite influential if enforced properly. The next domain, so that's for policy changes, those are the body checking policy and the head contact rules are really the policies with the most research behind them. The second area of concussion prevention would be personal protective equipment. This is what I'm most interested in with my doctoral work. And I'll start off with mouth guards in hockey. So mouth guards, we know, to lower risk of dental injuries. That's why they were made. Originally was to stave off dental injuries, but it's been a bit up in the air the past few decades about concussion. There's some work that's been done over the past few years that shows that yes, wearing a mouth guard does lower the odds of concussion with youth. This was at elite youth levels and also collegiate levels from the States. But no one had looked at it at all divisions of play. And this work was from my master's degree. And what was interesting to me when going through this is that in terms of mouthguard policies in youth sports across Canada, Hockey Canada and Ringette Canada are the two sport organizations that recommend mouthguard use, but there's no mandate on player use. Whereas football, rugby, and lacrosse Canada do have mandates for players to wear mouthguards. So this study that was part of my master's, we had 5 years of data across Alberta. All levels of play were included from that U13 age group and up. And this was about 3,300 players. And we looked at concussion rates between mouthguard users and non-users, and then the different mouthguard types. And what we found was that players who wore a mouthguard had a 28% lower concussion rate compared to players who didn't. Right, as a potentially simple and high impact strategies. Just by wearing a mouthguard, you can be at a lower risk of concussion. And the common question that I always get is, well, what mouthguards type? Is it the dentist fit, off the shelf? Well, I'm happy to report that both types both types had a lower concussion rate when compared with non-wears, with off the shelf type having 33% and dentist fit having 24%. And when, for you parents out there, coaches, if you ever get this question, which mouthguard is best, it's the one that the athlete will wear. So it's the one that's the most comfortable, the one that fits within the budget, and essentially the one that they'll want to wear over and over and over. So with mouthguards not being mandated with it's quite interesting, because it leads to the question of, should there be policy introduced to mandate mouthguards in youth ice hockey? And I think hockey, because the question of introducing policy always comes with the rebuttal of, well, how can we enforce it? And I think that hockey can pull from other sports such as football and rugby, where the referee skates by the bench at the start of the game and does smile checks. And if a player is not wearing a mouthguard, then there could be sanctions against the player, whether it be not allowed to play until they have one, or a team penalty, something like that. And you may be wondering, like, how could a mouthguard protect against concussion? Well, the answer is we don't know. We're not too sure yet, but there's 3 hypotheses that we think could be related to this. The first one is the activation. So just by having a mouthguard in your mouth and clenching, it's thought that you're activating muscles in your face and neck to help keep your head stable, and that might lower concussion risk. The second is the spacing. So you have a joint that connects your lower mandible jaw to the rest of your skull, called the temporal mandibular joint. And it's thought by having a mouthguard in, you're increasing the space at this joint, so that if you were hit, the contact at this joint would be limited. So the forces would be dissipated here rather than continuing on to the rest of your skull and the brain. And then the third one is what we all know is shock absorption, right? So just by having a mouthguard in, right, if you suffer a blow to the head or the jaw, there's going to be some type of shock absorption property from having it there. The next area of personal protective equipment that I'm quite interested in is helmet fit. So part of my doctoral research is examining or was developing and adapting helmet fit criteria to be easy to look at by anyone and across a number of different sports. So we're looking at ice hockey players, para ice hockey players, football players, ringette players, lacrosse players. And so we have 12 criteria that are rated as yes or no, or good fit, poor fit, to look at the different aspects of how a helmet should fit, right? Whether it be mobility, chin strap fit, face mask fit, or the helmet's position. So a question that we can have on the criteria is, does the helmet fit snug? We can ask the player to shake their head side to side quickly, and we're just looking to see if the helmet shell is moving outside of their head movement. If it's not, that means yes, it would be snug, and if it is, as it is on the right there, it would be a poor fit. It would be quite loose. Now, helmet fit is a pretty understudied area with concussion, but there are 2 studies that have looked at concussion. The first one is from our group here in Calgary that found that if you miss 2 or more of our fit criteria for hockey players, you're at a 2 times greater odds of getting a concussion. The second study is from the States in high school tackle football that found at the time of concussion, if you had a poor fitting helmet, you had a worse concussion experience. You had more symptoms and you had a longer time to recovery. And what's interesting to me about helmet fit is there's actually not a lot of training that goes available to coaches. I've been working with football, I've been working with hockey, and in sports like football, there's no standardized training available to all coaches. And with hockey and ringette and sports like that, it's actually up to the families to purchase the helmet and ensure that it fits on the player rather than the coach. So I'm looking at with football, because coaches are tasked with fitting the helmets and monitoring the fit throughout the season. My work will be looking at if training coaches on a helmet fit intervention and giving them our criteria affects concussion risk. And I bring this up, and I'm quite interested in this because when just looking at helmet fit without the context of concussion, just helmet fit as a whole, some work from my master's found that in elite ice hockey and ringette players, only about 20% of players had a good fitting helmet. And in tackle football, an original study on helmet fit was done in the States in 1995 and found that about 40% of players had a good fitting helmet. I did a preliminary study a couple of years ago with a high school tackle football team here in Calgary. And again, it was quite similar numbers of about 40% had a good fitting helmet. And this is quite concerning because a helmet should fit good to stay on the head and protect the skull. And that's really the goal of it. And if there's benefits to concussion prevention, that would be excellent. In other activities, so bicycling and ski snowboard, not team-based collision sports per se, but for skiing, snowboarding, once again, is just interviews that were done on a ski patrol hill, found that helmet use was high in the blue here. Over 80% of skiers, snowboarders were wearing a helmet, but the fit of the helmet was much poorer. And there is prior work that has shown that helmet use does protect against TBI, which is traumatic brain injury, which includes concussion, but there's not a lot that's looking at helmet fit. And if helmet fit's not fitting the best, right, there might be, again, concerns for the helmet staying on the head during the activity. Some other work in cycling that looked at helmet fit found that if you have a poor fit, so the helmet tilts back, it can come off while it's all done up, you're at the increased risk of head injury. So we need more research with helmet fit, but the results preliminarily show that there might be something there. And the last area of personal protective equipment is padded headgear. So these are mainly in sports such as rugby, Australian rules football, and whatnot. So there's a lot of research, which I'll cover in a sec, on this. But the three most high quality studies that have been done, one was from Australia, where they looked at concussion rates between players without headgear, with a standard headgear, and then with a modified headgear that had thicker foam. And what they found was that there was no differences in concussion rates between headgear wearers, non-wearers, the different types. There was really nothing there in terms of differing concussion rates. A second study that's coming out of England compared headgear with concussed participants and non-concussion injuries. As a control group, we wouldn't expect headgear to affect getting an ankle injury per se. And once again, they found no difference between the odds of concussion for headgear wearers versus no wearers. And the last study, similar with the past two, they had adolescent players, but they also found no differences in risk for headgear wearers or non-wearers for concussion. And headgear, there's a lot of reasons to wear headgear. More, it would be protecting the skull from getting lacerations, protecting against getting cauliflower ear, things like that. But in terms of concussion, the majority of studies, so this is 3/4 of the studies, actually showed that there's no differences in the risk of concussion. And going back to the meta-analysis from the paper Dr. Eliason led, that was part of the 6th International Consensus Statement on Concussion. These are all the studies looking at rugby headgear. And as we can see, if we're looking at the decreased risk side versus the increased risk side, most of them are right on that line of no difference. And the last domain that I'll touch briefly on is training strategies. This is the most understudied in terms of concussion. There's a lot of literature for non-concussion injuries, but in terms of concussion, we need more research here in training strategies. But I'll start this by saying neuromuscular warm-up. So this is a warm-up to really shock the system, prepare the body before activity with different components of aerobics, agility, strength, balance, and the newly added version of head and neck control. So if you've heard of the FIFA 11 plus or now the 11 plus, this is what that warm-up is. This is how it's structured, is with these different components. It's outside of the realm of just stretching. And it's meant to really prepare the body for activity. It's quite effective for lowering non-concussion injury rates, but we're not sure essentially about concussion yet. There is some work from rugby in England that showed that if you did these in schoolboy rugby, that shows that if you did these exercises more than 3 times per week, you had a lower concussion rate. And what's concerning is that some results that are coming out from our lab here is that in tackle football, for example, is these components are rarely used, with teams having about 5 minutes of warm-up per session. They're mainly aerobic and strength-based, but it's almost entirely stretching. And with head and neck control being the domain that we think might be related to concussion prevention, it was concerning to see that 1 out of 9 teams used a head and neck control exercise with their football team. So more work here is needed, more education about maybe warm-up structure and whatnot. And then the last area of training is mostly comes from the States, as about tackle technique and limiting contact practice. So in tackle football, there is a shift from sort of the head first, head down, driving the helmet into the stomach type tackle to a shoulder first, head up tackle technique. And these have been shown to reduce the concussion rates greatly by over 33% at the high school age level. And what some other groups in the States have found is that by having a comprehensive coach education session, which includes training about tackle training, equipment, so this would be helmet fit, limiting contact when possible in practices, right? These can reduce concussions significantly. And there's a lot of work going on with limiting contact practices as a whole, right? Restricting contact practices to 1 a week so that players are able to learn the fundamentals, the techniques to carry the ball, to have player-to-player contact without that high intensity need. So this would be limiting contact practices, limiting equipment at practices. But this is, like I said, this is mainly in the United States, and we just need more work in Canadian tackle football. So as I close up here, just in summary, prohibiting body checking does decrease concussion risk, and we need to look at this more in the female sport and the female version of the sport, so girls ice hockey and ringette. But across ice sports, we're seeing that we need to look at increased enforcement for head contact policies. For personal protective equipment, right, mouth guard use, there's some strong evidence now that exists for its implementation in youth ice hockey. And we should try to push this forward to try to get players to wear the equipment, because it's a simple and potentially impactful prevention strategy. We need to increase helmet fit resources to parents, players, and coaches, just from a safety standpoint. And as of now, headgear does not affect concussion risk in rugby players. In terms of training strategies, neuromuscular training is overall good for non-concussion injuries, and it may have additional benefits to concussion injuries. We need to look at that a bit more, but also in tackle football, and this will go for most sports, tackle training, limiting contact until absolute necessary might decrease concussion risk. Now, I've talked a lot about the research, and I just want to highlight that prevention research is not easy to do. It can be quite difficult, and it really relies on buy-in from the community, from the sport organizations, and from peers, scientists, the general public, to help move this along so we can understand the sports better and make the sport safer. So if you're wondering how you can get involved with prevention research, here's just some ideas in my experience that could help you get involved. So if you're a coach, parent, or player, you can advocate for your team or a player to be involved in research studies. Sport organizations, a lot of the research that I talked about is in combination between a research lab and a sport organization to think about how can prevention occur within the sport. Physicians and healthcare professionals, right, provide your experiences on projects, provide appointment times. A great thing about working at the University of Calgary is that our lab is quite intertwined with the Sport Medicine Center, so that we can get players into quite quickly to assess them for concussions. And just for everyone, you can stay maintained on your knowledge with concussion by sharing infographics from research groups. There's a bunch of learning modules to stay up to date with all things concussion. And these are three great ones that I'll highlight: the Concussion Awareness Training Tool, the Massive Open Online Course in Concussion, or the MOOC, and Parachute Canada's. So thank you everyone for listening. I'm happy to be here. I think I'm right at 44 minutes, so 15-ish minutes for questions. And thank you to my supervisors, Carolyn Emery and Brent Hagel, for mentoring.